It's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In the last blog, I shared how the ICU came home. You can check out last week's episode by clicking on the link below this video. In this week's blog, I want to share another very sad story of a 69-year-old gentleman, Alan Shepard, who has been unnecessarily confined to an ICU bed since December 2017 because Mr. Shepard is on a ventilator with a tracheostomy since he has been diagnosed with MND, also known as motor neuron disease. Mr. Shepard could go home with a service like Intensive Care at Home. However, the health authorities prefer to pay nearly $4,000 per bed day in intensive care instead of taking Mr. Shepard home, improve his quality of end of life, and cut the cost of the ICU bed to less than 50%. So the title of this week's blog post is Health Services in Crisis. Daughter begs for terminally ill father to have care at home. The following article below from The Express has been published a couple of weeks ago and illustrates once more how inefficient most ICUs are run when it comes to long-term ventilated patients and their families. Health authorities keep patients in ICU for much longer than necessary, pay a premium price on it, waste millions of dollars or pounds of taxpayers' money, and deny patients and their families quality of life during what is an extremely challenging situation for Mr. Shepard and his family. The article further illustrates once again how basic human rights are being denied in the name of a bureaucratic, dysfunctional and inefficient health system. Solutions are actually easy to come by with common sense by creating win-win situations, as Intensive Care at Home is a proven and successful care model, providing a genuine alternative to a long-term stay in intensive care. We also know from experience that transitioning patients home on ventilation with tracheostomy requires specialist skills from an accredited health service like our Intensive Care at Home service, who operates according to best practice international guidelines when it comes to mechanical home ventilation. You can check out actually the best practice international guidelines regarding the mechanical home ventilation on our website intensivecareathome.com. Unfortunately, most intensive care units around the world choose to stay 30 years behind what has been common and best practice now in many countries for nearly 20 or 30 years and provide intensive care at home services instead of hospital intensive care when it comes to long-term ventilation with tracheostomy. Now, before I go into the article, I want to quickly highlight the main points of the article. This situation is killing me, says Mr. Shepard's 34-year-old daughter Simone yesterday. We all just want Dad home. He wants to come home. His condition is deteriorating in hospital. I trained myself to look after him, but I can't do it 24 hours a day. We need some help. He's on a ventilator and can't be left alone for 1 minute. His daughter Simone continues on. Hospital bosses have warned that they could, quote-unquote, withdraw all NHS care unless Mr. Shepard agrees to being sent away from his family. This is all about money, but where's the sense in keeping him in an expensive intensive care bed instead of paying a lot cheaper rate to have him at home? I know that's more expensive than the cost of the private home in Peterborough, but it's only for a limited time and he will be with his family and friends. His daughter Simone continues to advocate for her terminally ill dad. His whole support group and life is at home. When the solicitor received the letter saying NHS care could be withdrawn, it terrified me. Again, that's from Alan's daughter, Simone Shepherd. What does that mean? He's paralysed and on a ventilator. The hospital has already told me they will not resuscitate him if something happens, which is not what he wants. Again, his daughter Simone Shepherd continues. He wants to live, but they also won't give him any antibiotics if he develops an infection. When palliative care in a hospice was mentioned, I was shockingly upset, says Simone Shepherd. He's stable, I've been told he's got around 2 years, but Stephen Hawking made it to 76. This is not the first time we as a family have come up against a funding block, Simone Shepherd says. Now, we also wrote about Stephen Hawking a few weeks back and made a video about it, why he lived until age 76. Well, the simple answer is that he had intensive care nurses around him who looked after him on a ventilator with tracheostomy, which is exactly what we do at intensive care at home. And everybody deserves the best care and not being stuck in ICU. That's very expensive also. This lack of appropriate care close to home is a sign of an underfunded care system. It needs to be urgently tackled by the government so that the aspirations that the health and care system is personalised become a reality. Now, I have actually put a link below this video where you can access the original article, and I also read it out now so you get the full story. Sarah O'Grady from The Express published this article on June the 14th, 2018. A pensioner with only 2 years to live has been trapped in hospital for 6 months, despite his family wanting to take him home. Alan Shepherd, 69, is unable to leave his intensive care bed because the National Health Service doesn't want to pay for local health services. However, it is happy to pay £5,300 a week for a private nursing home in Peterborough, 77 miles away from his home in High Wycombe, Bucks. His devoted daughter Simone, 34, has been her father's main carer since he was diagnosed with motor neuron disease at the beginning of 2016. This situation is killing me, she said yesterday. We all just want Dad home. He wants to come home. His condition is deteriorating in hospital. I trained myself to look after him, but I can't do it 24 hours a day. We need some help. He's on a ventilator and can't be left alone. He's been in that hospital now without his friends, not sitting up, not going out. He's only got a limited time left. I want him home. Peterborough is a long way from High Wycombe. It's an hour-and-a-half drive at least. How can I do that every day? Motor neuron disease is the same condition that physicist Stephen Hawking suffered from before his death at 76 in March this year. It is a fatal, rapidly progressing disease which attacks the nerves, leaving people paralyzed, unable to move, talk, and eventually unable to breathe. Mr. Shepherd's condition deteriorated to the point that he was admitted to intensive care at Wycombe Hospital in December last year. Miss Shepherd, who was forced to resort to a solicitor and family advocate to help her fight her case against Buckinghamshire Healthcare NHS Trust, has also been banned from taking photographs of her father. Hospital bosses have warned that they could withdraw all NHS care unless Mr. Shepherd agrees to being sent away from his family. Miss Shepherd, a former warranty claims engineer, before she gave up her job to look after her father, found a local nursing agency which quoted £7,500 a week to help her care for her father, a former mechanic. The cost of keeping a patient in an intensive care bed is around £14,000 a week, rising to as much as £10,000 a night for those suffering from spinal injuries and other complex conditions such as motor neuron disease or MND. Since he's been in hospital, he's lost his voice and lost weight, she said. When he was at home, he would have his dog Brogan and his friends around. We would take him out in his wheelchair to walk Brogan, and he could sit in his garage with his friends, where his friends would come round to work on our project car. This is all about money, but where's the sense in keeping him in an expensive intensive care bed instead of paying a lot cheaper rate to have him at home? I know that's more expensive than the cost of the private home in Peterborough, but it's only for a limited time and he will be with his family and friends. His whole support group and life is here. When the solicitor received a letter saying NHS care could be withdrawn, it terrified me. What does that mean? He's paralysed and on a ventilator. The hospital has already told me they will not resuscitate him if something happens, which is not what my dad wants. My dad wants to live, but they also won't give him any antibiotics if he develops an infection. When palliative care in a hospice was mentioned, I was shockingly upset. He is stable. I've been told he's got around 2 years, but Stephen Hawking made it to 76. This is not the first time the Shepherd family have come up against a funding block. Miss Shepherd and her partner, Ricky Thomas, 31, a fitness trainer and nutritionist, are £8,000 in debt after paying for care to supplement their efforts when funding was stopped last year before Mr. Shepherd went into hospital. Chris James, Director of External Affairs at the Motor Neuron Disease Association, said, "It is important that people with terminal conditions like motor neuron disease have maximum choice and control over their care package, including their place of treatment. It is vital that care services and local councils are responsive when it comes to care in the home, including housing adaptations, as this has a massive impact on the quality of life for those living with," Emily Holzhausen, Director of Policy at Carers UK, said. "Coming out of hospital and getting the right care can be hugely stressful for families and the person needing care. Delays in putting in place care arrangements and support for families pile unnecessary pressure and worry on families. Our research published only this week found 72% of carers were suffering mental health problems as a result of their caring role, with major stress factors including getting enough sleep and financial worries. Increasingly, research is showing that people with complex needs are struggling to find the right kinds of care, either in the home or close to home, which is what they want, to stay close to family and friends. This lack of appropriate care close to home is a sign of an underfunded care system. It needs to be urgently tackled by the government so that the aspirations that the health and care system is personalized become a reality. There is a right to family life under the Human Rights Act which must be considered when putting care in place. In March this year, there were 154,600 occasions when a bed was occupied by a patient who was fit enough to leave hospital. Of these, 100,600 were in acute care wards. As well as costing the NHS money, bed blocking increases the risk of infection for patients, leads to poor emotional health and a loss of independence and confidence. Philip Blond, director of think tank Respublica, said, "The way health and social care work together needs to improve dramatically. The bed-blocking crisis in the NHS is only getting worse, clogging up wards and leaving newly arrived patients on trolleys in corridors." A spokesman for Buckinghamshire Clinical Commissioning Group said, "Although we cannot comment on individual cases, it is the responsibility of NHS Buckinghamshire Clinical Commissioning Group to make every reasonable effort to ensure the specific needs of patients eligible for continuing healthcare are met through the care support packages we commission. Any ongoing care for our patients must be safe, sustainable, and at a level appropriate for their needs. Unfortunately, there will be occasional circumstances where, despite our best attempts, home care packages for those with very complex needs are not achievable or sustainable." And here, just as a comment and going away from the article, well, intensive care funding for a long-term patient is definitely not sustainable. Therefore, intensive care at home is sustainable. Going back to the article. In such cases, alternative care arrangements are sought as close to home as possible so that patients can maintain contact with family and friends. Sometimes there may not be local organizations with the capacity or skills to meet specific needs, and the placement may have to be sought beyond the patient's local area. Again, going away from the article for a moment, this could all happen in the patient's home with a service like intensive care at home. Going back to the article, such out-of-area arrangements are often made on a temporary basis until longer-term solutions can be found closer to home. To this end, we endeavour to work with patients and their families to ensure they receive the support they need while we continue to explore every care option available. When patients have complex healthcare needs, sometimes potential solutions that may seem appropriate on the face of it may not be fully able to meet those requirements, which is another consideration the CCG must bear in mind when making such arrangements. Patients with the capacity to make decisions about their own care have every right to refuse any proposed care support packages if they wish, but regrettably must do so at their own risk. So, carrying on and talking a little bit more, what is motor neuron disease? Motor neuron disease is a fatal, rapidly progressing disease that affects the brain and spinal cord. It attacks the nerves that control movements or muscles no longer work. MND doesn't usually affect the senses such as sight, sound, and feeling. It can leave people locked in a failing body, unable to move, talk, and eventually unable to breathe. More than 80% of people with MND will have communication difficulties, including for some a complete loss of voice. It affects people from all communities. Around 35% of people with MND experience mild cognitive changes, in other words, changes in thinking and behavior. A further 15% of people show signs of frontotemporal dementia, which results in more pronounced behavioral changes. It kills a third of people within a year and more than half within 2 years of the diagnosis. A person's lifetime risk of developing MND is around 1 in 300. 6 people per day are diagnosed with MND in the UK. It affects up to 5,000 adults in the UK at any one time. It kills 6 people per day in the UK, just under 2,200 per year. It has no cure. This is actually from the Motor Neuron Disease Association. Here is also a comment from Jane Connery from the Care Campaign for the Vulnerable. Alan Shepard walked into hospital A&E department in 2015, collapsed with stomach pains and was soon diagnosed with motor neuron disease. If that wasn't heartbreaking enough to both him and his family, 3 years later, they are now forced into an unwanted battle with authorities to grant him his wish of returning home to receive appropriate care for however long he has left. Care Campaign for the Vulnerable is now contacted by more and more families, and carers telling us the care sector grows an invisible cloak and families' voices are no longer heard. It's a lonely existence battling the care system. Families contact us begging to highlight their unfair treatment, knowing it's a way of finally being listened to. I've been there on a personal level with my mum, hence my reason for setting up Care Campaign for the Vulnerable over 5 years ago, and the Shepherd family is no exception. A loving dad stricken with motor neuron disease still has mental capacity to make his own decisions, and he's made one. He wants to go home to receive his care with his devoted daughter with a package of care available, and not to a care home over 77 miles away from his family. This should never be about what the system only deems to be quote-unquote not sustainable in achieving. His daughter and a nursing care agency is willing and able to offer a care package support to her father, and Mr. Shepherd wants to return home to continue his family life. The many shocking elements to this case are, I'm sad to say, not unusual. Care Campaign for the Vulnerable receives cries for help every day from families and family carers telling us they feel they are invisible. Receiving good care is becoming more of a lottery. This tragic case is not about what's achievable or what's deemed to be in the best interest of Mr. Shepherd. Let's face it, if that was really the case, Mr. Shepherd now would be on his way back home into the care of his devoted daughter and a team of qualified care staff. Again, qualified care staff is what you will get at intensive care at home. We exclusively work with intensive care nursing staff. Family life should be what matters here, and even more so with the Shepherd family. Time spent with their dad at home is now against them, while wasting their precious time fighting to be heard. So that was the end of the article. Now, if you want to find out how we can help you to get your loved one out of intensive care, including out of palliative care or long-term acute care, or also out of a nursing home, or if you find that you have insufficient support for your loved one at home, on a ventilator, or with other medical complexities, or if you want to know how to get funding for our service, or if you have any other questions, please give me a call on one of the numbers on the top of the website, or send me an email to patrick@intensivecareathome.com. That's Patrick just with a K at the end. Also, have a look at our career section for intensive care nurses. We are currently hiring ICU and pediatric ICU nurses for clients in Melbourne, Sunbury and in South Gippsland, Victoria. We are an NDIS, TAC and DVA approved community service provider in Australia. We have also been part of the Royal Melbourne Health Accelerator program for innovative healthcare companies last year. Thank you for tuning into this week's blog. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.